My name is Jessie Menzel, and I'm the director of our pediatric program at the UCSD Eating Disorder Center. I will be conducting an 8-hour workshop on ARFID along with Drs. Jenny Thomas and Kendra Becker from Harvard University. Dr. Thomas and Dr. Becker have been instrumental in developing one of the first treatments for this new eating disorder, cognitive behavior therapy for ARFID. Cognitive behavior therapy for ARFID is a full treatment for the spectrum of disordered behaviors that we see in this new eating disorder. So we'll be covering how to assess ARFID, how to conceptualize these cases, and then how to begin designing and implementing treatment with these patients. I'm most excited to teach about how to do exposure therapy with patients with ARFID. We'll be spending a little bit more time covering this aspect of treatment because it can be a little bit maybe daunting or challenging for therapists to use exposure therapy in their practice. I personally love watching patients undergo exposure therapy and learn how to master and take pride in overcoming their fears. It can be a little bit tricky to do exposures around eating and feeding, so we'll be spending a little bit more time talking about how to design these exposures and then how to implement them. So who is this workshop for, or what type of patient would this workshop benefit? The answer is all ages. We usually think about ARFID as only being a problem in children, but that's so far from the truth. ARFID can affect individuals across the lifespan. So we will be talking about how to treat these individuals, whether it be children, adolescents, or adults. Our workshop will particularly benefit those who are already working within the field of eating disorders, but also those who work within feeding disorders, so speech and language pathologists, occupational therapists. ARFID is really a diagnosis that sort of bridges both worlds, and I think that those from the feeding disorder world will get a lot out of our workshop by being able to learn more about psychosocial treatments for anxiety that could really enhance their practice. I also think that there are a number of individuals who may not see themselves as working with feeding and eating disorders, but who might get a lot out of this workshop. So pediatricians, nurse practitioners, those working with young kids who may see picky or fussy eating, or other kids with poor growth. I think our workshop will help those individuals better assess for the severity of their feeding or growth problems, and then be able to refer on to the appropriate specialties. I'm so excited for our 4th annual conference. I think it's very inspiring to get a whole bunch of great minds together and talk about the latest and greatest treatments in eating disorders. And I look forward to any time I get to talk about ARFID and exposure therapy, 2 of my favorite topics in the world.